It is said that the eyes are the windows to the soul. However, as ophthalmologists, it wouldn't be wrong to say that the eyes are the windows to our body. Our eyes are remarkably unique organs in which the transparent layers allow us to see the internal tissues and structures such as the blood vessels and the nerves non-invasively and in their natural form. And thus, small pathological changes in the eyes could depict similar changes occurring throughout the body. Diabetic and hypertensive retinopathy are commonly encountered conditions in which the severity of ocular findings is often a reflection of the systemic control. However, in this video, we will highlight some less commonly encountered conditions in which the eyes act as windows to larger systemic diseases. The first case is a 9-year-old child whose parents noticed a recent onset of abnormal body movements and gait. They attributed it to an episode of fever and sore throat a few months ago, and thus the child was diagnosed to have Sydenham chorea. The child had been receiving benzyl penicillin injections every 21 days for the last 18 months when he fortunately came in for a routine eye checkup. A significant finding on a routine slit lamp examination changed both the course of his management and his fate. This innocuous-looking brown ring seen in the peripheral cornea of both eyes is called the Kayser-Fleischer ring, and it occurs due to deposition of copper in the Descemet's layer of the cornea in a life-threatening and debilitating disease called Wilson's disease. Later, laboratory tests confirmed the diagnosis. On MRI of the brain, he was found to have T2 and flare hyperintensities involving the lentiform nuclei, the caudate nuclei, and the thalamus due to copper deposition. And thus, a small ocular finding proved to be a game changer for this child. And this due to the cornea being a specialized transparent tissue allowing the easy visualization of this abnormal deposition. The second case is a 25-year-old male who is an unoperated case of a congenital cardiac anomaly called the tetralogy of Fallot. He presented with a visual acuity of 6.6 in the right eye and a thicycle left eye since birth with no light perception vision. Fundus examination of the right eye showed extreme degree of dilatation and tortuosity of all the retinal vessels, similar to that seen in AV malformations. However, MRI of his brain revealed bilateral, similar diffuse prominence of all vessels of his brain. His hematocrit value was above 75%, which suggested that the vascular tortuosity was secondary to the polycythemia due to his cyanotic heart disease. The next case is a 56-year-old gentleman who presented with sudden diminution of vision in his right eye. Ocular examination revealed the retina showing opalescence and edema around the macula with occlusion of the cilioretinal artery in the right eye. However, on careful examination, there were multiple yellowish refractile cholesterol emboli of various sizes lodged in the blood vessels throughout his retina. The other eye was normal. CT angiography showed multiple atherosclerotic plaques in bilateral carotid arteries, aortic arch, and its major branches, causing significant hemodynamic alterations. Thus, tiny cholesterol emboli seen in the eye were suggestive of widespread atherosclerotic changes seen throughout the body. The next case was a 32-year-old female who was diagnosed to have a central nervous system tuberculoma and was on anti-tubercular therapy for the past 6 months. Her MRI brain showed a tuberculoma involving the right optic tract region with dilated ventricles. She had a corresponding left homonymous hemianopic field defect. Her optical coherence tomography showed corresponding homonymous ganglion cell thinning in both eyes. She had minimal pallor of the right optic disc and a bow tie atrophy in the left. On a follow-up examination 6 months later, her fundus examination revealed multiple subretinal whitish yellow lesions in both the eyes, suggestive of choroidal tubercles. Her MRI on this visit also showed multiple ring-enhancing lesions in the brain and spine, suggestive of miliary tubercles. The last case was a 26-year-old female who was diagnosed to have Takayasu arteritis and was on immunosuppressants. She was referred to us for diminution of vision. Her fundus examination showed all the retinal vessels ending abruptly even before reaching the equator. There were microaneurysms in the perfused part of the retina along with a neovascularization at the disc. Her fundus fluorescein angiography showed extensive non-perfused areas beyond the occluded vessels, and therefore she underwent panretinal photocoagulation. However, when she came for a follow-up 4 months later, her retinal vessels were found to have occluded further, this time barely even crossing the macula, along with a florid neovascularization at the disc compared to that 4 months earlier. Additional laser photocoagulation was performed. The peripheral laser scars here denote the earlier extent of laser that was done. She also underwent a catheter angiography, which showed complete stenosis of bilateral subclavian arteries, carotid arteries, and innominate arteries. The branches from the thoracic and abdominal aorta were normal, suggestive of a type 1 Takayasu aortoarteritis. Thus, progressive occlusion of the retinal vessels in this case is an indication of the activity of the systemic vasculitis. We hope that this video has opened our eyes and minds to the fact that ocular examination is not limited to the eye, but can be a reflection of one's overall health. Thank you.